Hi, I'm Jordan. I'm a student at Bergen Community College and I'm going to demonstrate tracheostomy care. So first of all, I've gathered my equipment. I'm going to enter the room. I'm going to introduce myself to the patient, identify the patient, checking their name badge, their date of birth. I'm going to raise the bed to working height. And before I begin, I'm going to auscultate the patient's lungs to check their lung sounds and make sure everything is okay. Okay, everything's fine. Before you begin, you always have to check and see that the suction is working, and you want to pre-oxygenate the patient at 100% oxygen for about a minute because there are going to be moments where they're not being oxygenated. So now I'm going to set up my tray. I have my saline cup. If I'm opening a new bottle of saline, I want to make sure that I initial it and date it because it's only good for 24 hours. You can lift the top, pour in a little bit. Put on your sterile gloves. Always make sure you're only touching the outer 1-inch margin. Now attach your suction catheter to suction. Okay. So now I'm just going to test and see if the suction is working. Everything's fine. So now you're going to go in into meet resistance, be as quick as you can because the patient is not breathing. And then applying intermittent suction, you go out. Reapply the oxygen. Give the patient a moment. Then you go back in again. Use intermittent suction. Always maintain one sterile hand and one clean hand. So now, when you're finished, you can dispose of everything. So at this point, I would remove my sterile gloves and put on clean gloves for the rest of the procedure. So I have new dressing, I have gauze, and then I have my saline and my peroxide, which I'm going to be using to clean around the site. So I removed the old dressing. And at this point, I'm going to replace the cannula. You have to pinch it by the rings and not any further lower down. So now you have a little bag, you're going to create your mixture, cleaning solution. And you have to clean around in one direction from 9 o'clock to 3 o'clock. So one direction, dispose of your Q-tip, get a new one, clean again, making sure you cover all the area. And then you replace the dressing. Always check in with the patient, make sure that they're tolerating the procedure, that they're comfortable. So when you're finished, you want to auscultate again. And the patient's lung sounds are fine. So you're going to document how the patient tolerated everything, the site, make sure there's no redness, no swelling, no sign of infection, the drainage, amount, consistency, odor, gel your charting, dispose of your clean gloves. Make sure that the call bell is in reach and that the patient is comfortable. Lower the bed. And that is it.